Hello and welcome. You're watching Health and Wellness, Save a Life, where we talk about heart health. I'm Gargi Rawat. More and more people, even young adults, are suffering from sudden cardiac arrest due to a sedentary and stressful lifestyle. Without immediate recognition and CPR delivery, the chance of survival decreases significantly as each minute without life-saving interventions passes. Now, it has been proven that bystander CPR improves the rate of survival by almost 50%. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death as well as the role of CPR to revive and save a life. Today we're joined by Dr. Deepak Kapila, Director Cardiology, Fortis Escorts Hospital, Amritsar, and Dr. KP Shamsuddeen, Consultant Cardiologist, St. Isabel's Hospital and Olive Heart Clinic, Chennai. Thank you so much, doctors, for joining us on the program. Dr. Shamsuddeen, if you could tell us, is it true that Indians are more prone to heart disease? And if yes, then why is this so?
Yeah, it's very true that we Indians are more prone for heart disease. Indians have a predisposition to heart disease, and it occurs in them at a younger age when compared to the Western world. We Indians are almost 2 to 4 times at a higher risk of getting heart disease when compared to the Western countries. There are so many reasons for the same. Like we Indians have a greater genetic predisposition to heart disease. Genetically, we are prone to get heart disease more heart disease when compared to the Western world. And Indians suffer from heart disease at least 10 years before when compared with people in the West. For example, we get heart attacks at the age of 30s and 40s, whereas if you see the Western world, they get heart attacks only after the age of 50 or 60. And for us Indians, the particular causes of concern in cardiovascular disease are the early age of onset, rapid progression, and high mortality rate. And risk factors such as hypertension, diabetes, dyslipidemia, smoking, and obesity are associated with an increased prevalence of coronary artery disease in Indians. The incidence of diabetes and hypertension is so high in India that many people get heart attack at an early age. Apart from this, our dietary habits are very poor. We include a lot of fatty foods in our diet, and this definitely doubles and sometimes triples the risk of getting heart disease. And the other important point is lack of exercise. The percentage of people who go for regular exercise is very less in India when compared to Western world. So if you do a regular exercise, we can definitely prevent or at least postpone the onset of heart disease.
All right. Dr. Kapila, if you could tell us, the higher your blood pressure levels, the more risk you have for other health problems. So how is blood pressure related to heart disease?
Yeah, hi, good afternoon. So blood pressure, we know one of the commonest problems, affecting almost 1 billion people in the world, and the commonest cause of mortality also in the world. So the ideal blood pressure we all know is 120 by 80, and anything above 140 by 90 puts us into the category of hypertensive. So what hypertension or high blood pressure does, it affects all the organs in the body, mainly the heart, the kidneys, the brain, the eyes. All these are affected by high blood pressure. So now how is the heart affected? High blood pressure basically is the pressure exerted by the blood on the walls of the artery as it flows through them. So by exerting this pressure, once this pressure is increased chronically, so what happens is that the vessel walls, they get injured, they are damaged, and subsequently the fat, the cholesterol starts depositing on these walls of the arteries and narrowing them actually. So once these arteries become narrow, the blood flow to the body, to the heart reduces. So once this deposition occurs in the coronary arteries of the heart, the blood flow goes down, the heart's working is affected, and when heart needs more blood, we cannot supply that, and that leads to ischemia or angina pain when we exert. So that is one reason how hypertension affects heart. The second is, once the blood pressure is high, our heart has to actually work a lot more than normal. Its working becomes much more tougher. It has to exert more, and once this exertion chronically, is there, then heart becomes thick. We call it hypertrophy. The left ventricle of heart gets hypertrophy to work more, as it has to work more than normal. The muscle gets thicker, and subsequently it keeps on getting thicker and thicker till it fails. It cannot continue like this indefinitely. and ultimately fails, and we call it heart failure. So these are two mechanisms. One is the coronary arteries get narrow, and second is heart failure. This is how hypertension affects our heart.
Right. Dr. Shamsuddeen, clogged arteries can lead to a heart attack as well as stroke. Are blocked arteries associated with high blood pressure? If you could explain this.
The main reason for getting heart attacks are blockage in the artery, as we call it as a clogged arteries. It can lead to heart attack when the arteries in the heart is blocked, or if the arteries to the brain is blocked, it causes stroke. And high blood pressure is a major cause of atherosclerosis, that is a deposit of fat in the arteries, which leads to clog of arteries. So high blood pressure can also cause blood clots to form in the arteries, leading to blocking of the blood flow, leading to heart attack and stroke. And blood flow to the brain and heart can be restricted by narrowed or even blocked arteries, resulting in strokes and heart attacks. Now, the high blood pressure even damages the inner lining of the arteries called as endothelium. Normally, this endothelium prevents the blood from clotting within the arteries. So when this high blood pressure damages the endothelial lining, it causes blood clots and reduces the blood supply to the heart and brain, causing heart attack and stroke. Now, high blood pressure also may cause a rupture of the arteries, something because the high pressure onto the vessel wall, it causes rupture, and it causes even major strokes. So hypertension definitely leads to atherosclerosis, damage to the vessel wall, leading to reduced blood supply to the heart and brain, causing stroke and heart attacks.
Now, Dr. Kapila, as most people still don't know the difference between a heart attack and a sudden cardiac arrest, many people may mistake recognizing the symptoms. So tell us, how do you know if it's a primary cardiac arrest?
So, Gargi, comparing a heart attack with a primary cardiac arrest, it's like comparing apples with oranges. These are totally two, different problems. Cardiac arrest or a primary cardiac arrest basically is an electrical problem. It is a problem in the electrical circuit of the heart. There is some defect in the circuit which causes heart to beat abnormally. We call it arrhythmias. And once it beats abnormally, it's unable to pump blood to the brain, to the vital organs. And once there's less blood supply to brain, one collapses. So it is basically primary cardiac arrest is a witnessed event where one collapses sudden, like a log of the wood, we say. Just fall down and starts gasping, and if not given help within few minutes, the patient dies. Whereas heart attack is basically a circulatory problem. There is a blockage in the blood supply to the heart. There is blockage in the coronary arteries, which give blood to the heart. And you usually have symptoms before that. There is chest pain, angina, or angina-like symptoms before a heart attack occurs. There is, we say, one of the severest chest pain which occurs. And once the treatment is instituted in the form of either, thrombolysis or angioplasty, and then there is immediate relief of this. Though even heart attack can lead to sudden primary cardiac arrest because of the ongoing ischemia. But once it is treated, patient is perfectly all right. So that is the difference between a cardiac arrest and a heart attack.
Right. And Dr. Shamsuddeen, if you could tell us, what is the importance of home blood pressure monitoring for people with cardiac conditions? Are home blood pressure monitoring devices accurate?
See, hypertension is the most common preventable cause of cardiovascular disease. There are a lot of causes like diabetes, dyslipidemia, etc. But then I would say that hypertension is the most common preventable cause. So monitoring blood pressure changes at home can help you and your care provider make the decision about the treatment, because whenever you come to a clinic or a hospital, because of the anxiety and other reasons, your BP may not be accurate. It may show a higher value. Whereas if you check your BP at home and regularly monitor with a good device, we can definitely decide upon what tablet is needed, whether you need to step up the dose or reduce the dose according to the values. And if you take medicines to control your blood pressure, and it will, if you monitor it regularly at home, it will help to document if they are really working or not. If such medicine is not working, and if your BP is high, still at home monitoring, we can change the medicine in that way. Home BP monitoring is very useful. And measuring your blood pressure at home is a good way to actively manage your health, because based on the BP values, we can decide, your doctor can decide whether to change the medicine or continue with the same medicines or decrease the dose, etc. And nowadays, we have a lot of devices to monitor BP at home. And I would say that when used correctly, these devices are accurate and it gives a almost accurate value, maybe plus or minus 5 millimeters difference may be there, but it is wise that you monitor BP at home with these devices.
Right. Dr. Kapila, can hypertension cause sudden cardiac death, and how common is death from high blood pressure?
Yeah, Gaki, hypertension definitely is one of the commonest causes of heart-related deaths in the world, the cardiovascular deaths. In fact, almost 10 lakh deaths every year world over due to high blood pressure. Not only high blood pressure itself, half of the deaths are due to heart attacks, due to brain strokes, they are related to high blood pressure. So hypertension is the commonest cause, as we say, world over, especially in people above 50. That is the commonest, problem causing death. Now, how it causes sudden cardiac death? Yes, it affects the heart in a way that sudden cardiac death does happen. And the etiology again remains the same as we discussed earlier, that there is narrowing of the coronary arteries, there is gradual damage to the endothelium of the coronaries, there is plaque deposition, narrowing of the arteries, and once these plaques rupture, they cause heart attack. And heart attack itself is a commonest cause of sudden cardiac death. So that is one reason. The second is, as I told you, heart has to work more. There is thickness of the heart muscle because left ventricular hypertrophy. Left ventricular hypertrophy is itself a single most risk factor for sudden cardiac death, especially in the young people. So left ventricular hypertrophy, it causes some changes in the functioning of the heart, in the form that its metabolism is changed. There is lipid toxicity, there is cholesterol fat toxicity to the heart. There is actually derangement of the electrical circuits within the heart. There is derangement of the, as we say, sympathetic nervous system or the hormonal changes in the body. All these, they lead to sudden cardiac death. So by causing coronary narrowing and left ventricular hypertrophy and heart failure, hypertension makes us more prone to sudden cardiac death.
All right, with that, we'll slip into a short break, but don't go anywhere. We have more questions for the doctors regarding heart health. Stay with us. Welcome back. You're watching Health and Wellness. We're talking about heart health. Let's go across to our panel of doctors. And Dr. Shamsuddeen, we all know if it's not treated, sudden cardiac arrest can cause death within minutes. What are the chances of surviving it? And in what cases do the chances of surviving become more?
Sudden cardiac arrest can cause death within minutes unless otherwise we act immediately. And the reasons for sudden cardiac death, not only heart attack, it can be because of the stroke or some internal bleed or some anaphylaxis or some major allergy. So in sudden cardiac arrest, there is the heart suddenly beats, heart stops suddenly beating. So what happens is there's a circulatory failure. There is no blood flow to the brain or other organs in the body. So patient collapses. So there is no heartbeat. So action has to be taken immediately. And any sudden cardiac arrest victims, they survive only if they get help very quickly. And if CPR is initiated within the first minute of sudden cardiac arrest, there is a high chances of survival. And if any sudden cardiac arrest happens, if the bystanders give the CPR and use AED, that is automated external defibrillator, the chances of survival increases. So I think most of the people or in general population to be trained about the CPR and the usage of AED, automated external defibrillators. Nowadays, I think various organizations, including government organizations, have arranged defibrillator in a lot of public places. So when sudden cardiac arrest happens, we are allowed to immediately use that. So whenever there is a good quality CPR initiated in the early period, the survival chances are very high.
Now, Dr. Kapila, which is the correct first step when you're at a scene where a person has collapsed, if you could tell our viewers?
Yeah, sure. If you witness a collapse anywhere, in your city, so immediate aim should be to place the patient comfortably in a relatively safe place. So take him to a footpath, to a side of the road, make him lie on his back. And then most important step is to check for the responsiveness. We call it, shout, tap, shout. shout if he's okay. If there's no response, tap his shoulder to see if there's any responsiveness. And if there is no responsiveness, just shout for help. So third is just check his breathing and his pulse. This all should not take few seconds. And if there is no responsiveness, no breathing, no pulse, immediately start a CPR. Now, as Dr. Shamsuddin told us the importance of CPR, which if instituted within few minutes, actually saves a lot of lives. And the CPR given on roadside, what we call as BLS, that is the basic life support. That's why we always tell everybody, the government people, that this basic life support should be taught to everybody in the country, in our schools, colleges, all institutes. And second is, of course, as he said, if there is external defibrillator available nearby, especially in a malls, in a airport or at railway stations, so electric shock given at that time, saves life much more than CPR alone. So it's very important to see patient quickly, judge if he's responding or not. Start a proper CPR, chest compressions, fast chest compressions, almost 100 to 120 compressions in a minute, and then maybe mouth-to-mouth breathing. If he is not breathing, call for help and ask people to call ambulance as early as possible. All these measures done, at the site of collapse can really help the patient to survive. Otherwise, they have a very dismal, survival as such.
Now, Dr. Shamsuddin, if you can tell us about different types of CPR and which is the most commonly used.
Someone is unconscious and not breathing normally, you should immediately call the emergency number and start the CPR straight away. And there are different types of CPR. That is, one is just giving only a circulatory support by giving chest compression. The other one is giving a respiratory support by doing mouth-to-mouth breathing. And a lot of other CPRs are there, like cough CPR. If the patient is semi-conscious, you can ask him to cough. Sometimes if they cough once or twice, they might regain consciousness and their heart might start beating again. And if there is no trained people around, they can even use a precordial thump. Just bang on the chest once, they might recover. So that is also one of the type of CPR. And if you have been trained in CPR, including rescue breaths, and feel confident using your skills, then you should not give chest compressions with rescue breaths. At least every 30 chest compressions, give 2 rescue breaths. And if you are not completely confident, attempt at least hand-only CPR. Means just give only chest compressions at a rate of around 100 to 120 per minute until the paramedics arrive. And if possible, call for help. Other bystanders might know a better CPR. You can always take help and give both circulatory as well as a respiratory support so that the results are better and you can save many lives by doing so.
Right. Dr. Kapila, is there a relationship between heart problems and blood sugar? If you could explain that to viewers.
The high blood sugar, what we call as diabetes, we are now the diabetes capital of the world. We have maximum number of patients having diabetes, especially down south. We say Hyderabad probably is the diabetes capital of India. Now, the problem with diabetes is it will cause, heart disease much earlier in life, in much younger people. And the reason being that it affects the narrowing of the arteries. It causes coronary narrowing, what we call as accelerated atherosclerosis. So by causing narrowing of these coronaries, it causes heart attacks at a much faster pace, much earlier in life. That is one mechanism. Second is diabetes also affects the nerves in the body, in the nerves of the heart, nerves in other parts of the body. And by affecting the nerves, it's known to cause something called as diabetic cardiomyopathy, which involves, again, the thickness of muscle, making the heart muscles weak and ultimately leading on to heart failure. And another thing we ought to remember is that diabetes doesn't occur alone. It is associated with other risk factors for heart disease. Like in diabetics, high blood pressure is very common. Their cholesterols are mostly deranged. They are very high. They are usually obese people. They have multiple problems. They don't exercise. They don't eat too well. So all these add on to the risk factors of diabetes. And that, diabetics are 2 to 4 times more prone to have heart attacks. That's a well-known factor. So there is a huge relation between diabetes and earlier heart disease.
All right, Dr. Shamsuddeen, smoking now is one of the main risk factors for heart disease. And if a person who has been smoking for a long time actually stops, will the risk of heart attack then be reduced?
Yes, smoking, of course, all of us know that smoking carries high risk for getting heart disease. Smokers who quit start to improve their health and reduce their risk of cardiovascular disease immediately. From the day one of quitting the smoking, they definitely have a benefit. And within the year, the risk of heart attack drops dramatically. So if they stop smoking, the benefits are seen immediately, and within a year, the chances of them getting heart attack reduces to a significant amount. Now, people who have already had a heart attack, if they stop smoking, they can reduce the chances of getting second attack significantly. So smoking, if stopped at any stage, will definitely reduces the further risk of getting heart attacks. And if stopped early, the benefits are more. In India, we can see that even though the incidence of smoking has come down, even a large population of people are still smoking. So I would advise them all to stop smoking from today itself, so that we can reduce the number of heart attacks and mortality.
All right. Well, thank you so much, doctors, for joining us on the program and answering all our questions about heart health as well as CPR. Thank you all for watching at home. Time for us to slip into a short break. More news coming up on the other side. Stay with us.